today I just want to give you 10 reasons why you need to see a podiatrist. For some people who haven't ever seen a podiatrist, so this is a good video for you. Please just stay tuned and hear what I have to say. So reason number one is if you've recently developed an interest in running, or you want to start taking your running seriously. It is a very good opportunity for you and a very good reason for you to go see a podiatrist. So runners are more prone to injuries in the lower limb, such as ankle sprains and strains, or what we call shin splints, or what we call iliotibial friction syndrome. So all of those terms, you'll get to understand them when you go to see your podiatrist. So what could actually cause these problems is what we call oversupination or overpronation. There is supposed to be some pronation and some supination in the lower limb, in the foot, so to say, when you're moving, when you're walking. But then if it's over the normal range, then that will cause you problems like sprains and strains, overstretching of your muscles, overstretching of your ligaments. So your podiatrist will do what we call biomechanical assessment to check your body and foot alignment, so that they can give you better advice on how to prevent those injuries, like footwear advice, or training advices, or consult with your coach if they need to, or prescribe devices if they see that you need those devices to prevent those injuries before they could even happen. So the devices will help you to move in a normal range, to supinate and to pronate in a normal range. So and then reason number two is if you're experiencing pain in the ankle, in the heel, and on your arch. You can experience pain anywhere else, such as in your med heads, like this part right here, right? But I want to talk about the ankle and the heel. Ankle and the heel and the arch. So arthritis is actually the leading cause of those problems. So seeing your podiatrist, they will perform assessments, and then they will give you management or treatment so that they can preserve your joint ability, okay, or your joint integrity, all right, or to even help you to prevent the pain, with the use of orthotics or remedial therapy, or any other treatment that you and your podiatrist decide that is right for you. Okay, and reason number three is if you're diabetic. So if you're diabetic, definitely you need to consult with a podiatrist at least once a year. So the podiatrist will perform assessments, what we call neurovascular assessment, to check your nerve function and your vascular function, to ensure that they do not die any further, to help you together with your GP or any other doctor that is involved in your treatment, in your systemic treatment, to help you to preserve the lower limb. So diabetes is one of the leading cause of disabilities due to infections. It could range from dry skin to severe infections. So to preserve your foot, leg, your foot health, you need to consult with your podiatrist. They will be able to prescribe devices to offload the pressure, to treat you with anything else that you come in with, lack of sensation, maybe you've recently developed that, or any other symptoms that you may be seeing as well, that you may be experiencing as well. So if you're diabetic, definitely you need to see your podiatrist. Pain around your ankle, around your heel, around your arch, or anywhere else in the leg. Pain could be caused by a lot of things, could be due to a lot of reasons. However, calc spay, or what we call plantar fasciitis, I will explain the two, is the most prevalent cause in adults. So it is very much important to consult your podiatrist concerning that, so that they will provide remedial therapy to relieve you of the pain. They will provide footwear advice to relieve you of the pain. Also, they can do biomechanical assessment again to prescribe devices for you that will help you to alleviate the pain, or to further prevent the pain from occurring. So plantar fasciitis is the inflammation of the fascia. A fascia, sort of like a layer, that is made up of something so strong like this, what we call ligaments. So that fascia, it gets stretched, overstretched when you're busy putting weight on top of the foot. So in people who have flat feet, it causes them to overpronate. The flat feet causes them to overpronate when they're walking, which means over-rolling their feet inwards when they're walking. So that causes the fascia to overstretch, and in turn causing inflammation of the fascia. So it could cause pain on its own. The podiatrist will advise you on exercises, provide remedial therapy like I already explained to help you with that. And what we call the calc spare is now when that fascia is over pulling on this bone where it originates from, because of the pressure or the weight that will be placed on the foot. So the more it the more it pulls. The more it pulls on the bone here, it causes the bone to grow. So that causes what we call a calc spare. That is extremely painful for most people, and it can actually limit you from carrying on with your own day-to-day activities. And reason number 5 is if you have stubborn ingrown toenails. Most people can easily cut out the nail spikes on their own, which is not really advisable, because if you cut them in the wrong way or you go in deeper, when they come back, they will grow even more further. So it means that the ingrown toenail won't go away. It will keep on coming back, or it could be the pressure. It could be caused by the pressure that is resulting from the shoes that you're wearing. If your toes don't get enough space in the shoes, so that will cause pressure against the nails, causing the nail spike to further insert itself into the skin sulcus. So that causes what we call ingrown toenail. Sorry man, I'm expecting someone in a few minutes, but however, I want to finish up this video. So ingrown toenails, that is one very good reason for you to go see your podiatrist. Your podiatrist can treat that conservatively using a blade to remove the nail spike, and to advise you on how to take care of your nails to further prevent the reoccurrence of the ingrown toenail, or to remove it altogether using surgery, using what we call nail wedge resection. However, the decision of surgery and all that will come from you and your podiatrist. And reason number 6 is wounds. Wounds can be caused by a lot of reasons. It could be injuries from somewhere, you could have bent from something, a lot of reasons. Maybe you cut yourself or something like that, or maybe you stepped onto something sharp. So it is very advisable to visit your podiatrist if you have a wound, for them to be able to prevent the infection, to prevent the wound from getting worse. Okay, so it is very advisable for you to see your podiatrist. There are different types of wounds, especially in diabetic patients, what we call arterial wounds, what we call venous wounds. All of those things you can ask more from your podiatrist, or me. Send me an email or an inbox or whatever, so that you can find out more about that. And then reason number 7 is painful bunions. So painful bunions can be caused by anything. They can occur mostly here on the big toe. This is the big toe, or the smaller toe. So the bunions are caused by a deformity in the development of a deformity in the foot structure. So this is how your toes should normally be, straight like this. But then some people develop that from rheumatoid arthritis, the change in the foot structure. Others develop that from the types of footwear that they put on. If you're putting on shoes that doesn't, it occludes your toes, it causes occlusion in your toes. It doesn't give your toes enough space to move around, so that causes the structure to slowly, you know, skew this bone, like to bring it inwards from this joint here. The bone will then be pressured to go inwards like that, so that causes a lot of pressure there on the skin and now on the bone structure. Same thing as on the smaller toe. On the smaller toe, the structure will then deform, and then causing a lot of pressure to go onto the smaller toe, the side of the smaller toe. That is what causes the pain. So your podiatrist will prescribe devices that will help you, you know, your bunion splints, to help you to correct that deformity. Footwear advice to help you for your toes to have enough space in the shoes and to prevent that pain from getting further, you know, and give you silicone devices that you can be able to place in your shoes while you are moving about, you know, so that you can prevent the pressure from getting directly onto the skin. And reason number 8 is if you're just experiencing pain, you know, what we call rest pain. When you're experiencing pain but you're sitting, you're resting, like you are sitting down but you're experiencing pain, or especially in the legs, in the calves, that could indicate what we call intermittent claudication, meaning that there's something that could be happening at your legs, not enough blood flow for the nerves, for the muscles, yada yada. So you have to go and get that checked by your podiatrist, because it could be underlining a much more serious condition, like a venous insufficiency related condition. So you should go and see your podiatrist if you're experiencing that. Reason number 9, painful cons and calyces. It happens to the best of us. Painful cons and calyces, they could be extremely painful, especially with certain types of footwear. So for the treatment of that, yes, some people use corn blade at home, and I'm sure it works just fine, but your podiatrist will check, will assess your foot to look at your foot if there are no deformities there, like your claw toes, you know, or your hammer toes, or any you know, your high arch. Maybe you have a higher arch, that's why you're experiencing cons and calyces. So cons and calyces comes from the pressure that you place on those areas. It could be because now the foot structure is changed, you have some form of deformities, and that's why most of the pressure is going to the same areas of the leg, unlike how it's supposed to be normally distributed. So your podiatrist will treat those, and also will give you footwear on how to prevent them from getting worse, and also will prescribe devices that will actually help you to not get any further pain from the cons and calyces, and even prevent them from developing any further. And reason number 10, footwear advice. I know that most people don't like the footwear that podiatrists prescribe, but then actually it can do you good. Yes, so go to see your podiatrist for footwear advice, or for, you know, anything that you could use to like take care of your feet, to preserve your feet's health. Free advice related to legs and feet. That's what you should do, right? See your podiatrist. All right, well, thank you so much for tuning in once again. This is me signing out, and then this is me saying I will see you again next time. Cheers. Bye. Like, share, subscribe, refer someone to a podiatrist, or come to visit a podiatrist. Thank you.